Welcome to this session on climate change and health, challenges and responses in two diverse locations. So what we hope to do today is to contrast some of the challenges posed by climate change to the health systems in Queensland, in Australia, and in Bangladesh. And there are some similarities in terms of the climate. They're both subtropical, hot climates with high humidities. So they face rather similar challenges from climate change, but one is a low and middle income country and one is a developed country. So some of the responses and the options open for adaptation are very different. So we hope to look at those in this session. We have four speakers. The first is Dr. Peter Schneider, who's from the Health Protection Branch of the Queensland Department of Health. So he's able to give us a practitioner's perspective on this. Then we have Dave Rissick from BMT Australia, who is, I think, going to look at a project that they're running in northern Queensland. Then I and Fahim, myself, Jean Politikov, and Fahim Tonmoy, together we will look at a project that we are currently running in Bangladesh to look at heat stress in the ready-made garment industry. So as you can see, we're looking in the first two presentations at challenges to the Queensland health system, and in the second two presentations to what is happening in Bangladesh. So without further ado, let's begin. Our first speaker is Dr. Peter Schneider, and he's an advanced environmental health scientist with the Health Protection Branch of the Queensland Department of Health. So Peter, over to you.
Thanks, Jane. Thanks for the introduction. Hello, everyone. My name is Peter Schneider, and I'll briefly describe some climate change adaptation tools being used by the health sector in Queensland, Australia. Next slide, please, Jean. Just a bit of background first for all our international participants. Queensland Health is the largest health provider in Queensland. It accounts for about 70% of health services across Queensland. To give you a sense of scale, Queensland's about half the size of India. It's just one state of many in Australia. We operate, give or take, about 170 hospitals, and this is done via a system of regional hospital services. And there's a map there, and you can see how the services are broken up across the state, from the far north tropics down to the subtropics in the southeast corner of Queensland. These 16 discrete health services have their own governance structure, their own boards, make their own decisions around the types of services to be developed and how services are delivered. Next slide, please, Jean. Now, late last year, Queensland Health released its climate risk strategy, which is its principal climate change policy. The policy is broken down into 8 theme areas, and these theme areas we developed over a period of about 1.5 years through some quite substantial consultation with internal practitioners, service providers, and external groups, including patient representative groups, health system advocates for climate change, unions, and so forth. So the results we got were fairly consistent, so we're fairly confident that the 8 areas we've got cover the main issues. Now, the first area, leadership and governance. Well, actually, I might add, each of these areas then have a breakdown of objectives within them, ranging from 2 to 6 objectives in each area. If we could have the next slide, please, Jane. Now, leadership and governance obviously is critical, but under leadership and governance, we've identified the need to develop, in the red there, climate action plans using the suite of tools we've provided to our hospital and health services across the state. Next slide, please. So what are these tools? The tools really come in three parts. We've got the guideline itself, which is a two-tier risk assessment. We've got an almanac that provides some basic information on climate and how we expect climate to change over the next 50 or more years. And we've got a couple of spreadsheets in there, one for each of the types of risk assessments undertaken under the guideline. The templates actually provide a step-by-step process for developing an action plan. There are prompts through the templates, and really once you've completed the template, you effectively have an action plan for climate in your area of operations. Next slide, please, Jean. So I know I say 5 steps at the top and I've got 6 listed, but there's a reason for that. So really the way the guideline works is you undertake a tier 1 risk assessment, which is some general background information and some basic analysis of hazards and risks. The tier 2 delves into a more detailed analysis of hazard analysis and the risks, but it goes further in terms of identifying what residual risks you're likely to come up against as a consequence of changing climate, and then looks at how you can mitigate those additional areas of risks. We've got evaluation of adaptation options undertaken as a part of that process. And then at the end of it, you should have, as I mentioned previously, an action plan that you can work to. Now, separate to all that, but I think just as important is the process of implementation and monitoring. Without monitoring, you won't know how you're going and you won't understand how your mitigation actions are actually serving you. Next slide, please. So here's just a little bit of an example of the tier 1 risk assessment. And you can see that it's fairly basic. You look at what RCP you want to address. You look at your time frame. You look at what you're trying to achieve, the areas of your business that need to be considered, the types of people that need to be involved. And as I mentioned previously, what's also included, and I didn't want to make the slide too busy, is you'll be starting to look at some of your basic hazard and risk analysis as a part of this tier 1 assessment. So the process leads you gently into the risk assessment framework. Not everyone's familiar with risk assessment. It can be a bit daunting to look at it from the outside if you haven't done one before and be caught up in the technicality of it. But really, this process does simplify it dramatically. We did run training programs for well over half of our hospital and health services now, and whilst there was some trepidation by them to begin with, they did rate the guideline 9 out of 10 for usability and simplicity and accessibility. So once you do actually access the guideline, it really leads you, and you don't have to worry too much about trying to have an upfront understanding. You gain that understanding as you're using it. Next slide, please, Jean. So the tier 2 risk assessment gets into the nitty-gritty of what we understand is the more traditional risk assessment. So you provide further detail about your hazards and your risks. You will look at your vulnerabilities, your residuals, or your residual risk. So most people have risks they've identified and they're dealing with those on a day-to-day basis. However, this process here, using the almanac, feeds you the information you need to be able to forecast what additional risks you will be encountering over the next few decades. And those additional risks will then provide that residual risk that you need to address and respond to with additional mitigation measures. Hopefully that will all make sense. And anyway, next slide, please, Jean. So the almanac. So we've dealt with the guideline in terms of the 2-tier risk assessment, but then we've got this document called the almanac. Now, the purpose of the almanac was to save people having to sweep the web and seek climate resources or climate information resources while they were also starting to commence this process of risk assessment. We felt it was all going to be too much, so we developed a compendium of information that looked at the basic background information so that we're not assuming anything. We're not even assuming you know what the modelling outputs are for climate over the next few years. That information is provided as a part of the almanac, and you can see some of that information here. Next slide, please, Jean. What it also provides, the almanac provides a breakdown on a regional basis or a hospital and health service operating area basis, what the predicted climate will be moving forward. So what we've got here is a couple of snippets of information for the Cairns area, which is working in the tropics. And you can see from this that there'll be changes to fire frequency, high temperatures. There will be sea level extremes. In fact, the major hospital system is right on the coast in Cairns. So it's on the leading edge of areas expected to be impacted. And if we look at the little table, one of a few that are provided in the almanac for this area, you can see that, for instance, that temperatures over 40 degrees are predicted to increase by close to 400% over the next 70 years. This is in the area of Croydon, and 1,000% for temperatures over 35 degrees. So very clearly we're going to be seeing rising temperatures, but there will also be more extreme temperatures as a consequence of this process. Cairns, the capital in this area, Cairns, is going to similarly see large increases in temperatures above 35 degrees. So this is one example, but there are also tables on nighttime temperatures, sea level rise, and so forth provided in the almanac. Next slide, please, Jean. I think more importantly, the almanac also provides a breakdown of the types of hazards and risks that the hospital and health services might need to consider. And it also identifies the types of potential responses that you could incorporate as a part of your mitigation strategies as you develop your action plan. So what we found is people are often at a loss of where to go with the information once they have it. But really the almanac and the guideline provide a huge suite of choices. They're not comprehensive, but there's certainly enough there to kick you off and start your thinking or even start your process. Next slide, please. So only last week we got our external website up. There's a link there, but really if you want to search for any of this documentation, you just have to type in Queensland Health Climate Change into your web browser, and this site will come up. I've tested it, so it does work. And under the climate risk strategy and adaptation planning guidelines category on the left there, if you click on that, you'll get access to all the documentation I've talked about, including the climate risk strategy for Queensland Health. Next slide, please, Jean. And if you would like to reach us, you can reach us on this email address. And look, belatedly, I'm sorry I didn't mention the guidelines were developed in partnership with the National Climate Change and Research Facility at Griffith University, based here in South East Queensland in Brisbane. And I would add that we couldn't have done it without them, and they've been guiding the process and informing it as we've gone. So just an acknowledgement to NCARF for the good work they've done. And as I've said, the guidelines have been very well received and are currently being used by a number of health services to develop their climate action plans. Thank you.
Thank you, Peter. That was very interesting. So I think what we would like to do now is to hear Dave Rissick's presentation, which is also about Queensland. And then because Dave has to leave us at midday, we can take questions about these two presentations that are dealing with adaptation in Queensland. So do you want to go ahead, Dave? I should introduce you first. Dave is a senior scientist with BMT, a consulting company which is international, but he's based here in Sydney. He's also an adjunct professor at Griffith University. Go ahead, Dave.
Thanks very much, Jean, and good morning, everyone. So I'm going to be talking about a case study of climate risk in Queensland. I'll put it in the context of where it is in a moment, and just recognising that this work was done before the guidelines that Peter's just talked about were developed. But I'm very happy to say that it's very consistent with that approach, because all of these are following leading global best practice in climate risk assessment processes. And just acknowledging my co-authors on this work, Beth Tockey from BMT and John Rainbird from the Torres Strait Regional Authority. So the Torres Strait Islands are a small group a large group of islands, several hundred islands, in fact, spread over the tip of the northeast of Australia. Very small islands, but spread out, sprinkled over a 48,000 square kilometre area of very shallow sea between Australia and Papua New Guinea. There's a range of different inhabited islands in that area, and 18 different cultural communities live up there. The islands are pretty diverse, so they range from being mud islands, and I'll show you a photo of those in a moment, but also coral keys, but there's also volcanic islands and continental islands. So very, very different group of islands in that space. And importantly, when you're starting to deal with some of the health challenges in these places, are that the Torres Strait is very physically, but also culturally and administratively complex. And there's a treaty between Australia and Papua New Guinea that allows people to move between those islands. And that's really relevant to the health challenge, because we've got very different health systems and approaches in the two different countries. And so often you'll get people presenting with new health challenges to some of the facilities in the Torres Strait. So adding to some of the challenges for the very busy health sector in Australia. So this is a photo of one of the islands. The thing to look at here, and I think people will recognize from a Bangladeshi perspective, is very low-lying, mangrove-lined and very coastal communities. You can just look at that and know that if you've got higher sea levels, there's going to be a lot of challenges for those particular communities. Again, this is another photo from one of the other islands, showing very small areas of inhabited space. And you'll see as I talk about this, some of the sort of cultural challenges and the social challenges that come out in making addressing health so more difficult than in other places in Australia. As far as the climate change challenges for the area, increased temperatures are a huge issue, and Peter's presentation before, where he showed some of the challenges in Cairns, which is about 500 kilometres south of these islands, really shows that the increased temperatures are not only atmospheric but also oceanic. It's something that again plays into the challenges for mental health in this particular area. There will be heavier, more intense rainfalls intermittently, but there will be longer, more intense dry periods and droughts. So real issues for small islands where you have low amounts of water available. Higher sea levels is probably the biggest issue that these communities face. And of course, being in the northern areas of Australia, cyclones and associated challenges are also an issue for these communities. This is just a map of some of the one of the small islands called Marsik, and it's showing where there's risks associated with different levels of sea level rise. Now, the lowest levels of sea level rise are shown in green, And the little white dots that you see on that image are actually the houses and the infrastructure. So very low lying and very challenged by just slight increases in sea level rise. So the work we did was to undertake a first pass risk assessment, almost at that first stage of the risk assessment process that Peter talked about before. And the way we did this was to really undertake a series of semi-structured interviews with a range of targeted informants. So we talked to different health professionals, both from the nursing sector, the administration of hospitals, but also the healthcare professionals themselves, so doctors. We talked to climate change champions in the region who are knowledgeable about the people and their needs from a health perspective. And we also talked to representatives from the local government side of things in the area to get their input. The things we were looking at was their awareness of any direct impacts from climate-related issues to human health and human health-related services and infrastructure in the region. We wanted to find out if they knew any of the indirect impacts of climate-related issues. We wanted to understand what sort of management was being done at the moment and whether it was successful. So again, following the guidance that Peter talked about before, understanding those residual risks. And we wanted to talk to them about the trajectory into the future in terms of climate change. So what were those existing risks and what new risks would appear? We talked about what groups of Torres Strait Islanders might be more vulnerable to the effects of climate change, trying to understand why and how. And we looked at certain sectors in the Torres Strait that might be more vulnerable and tried to determine why and how. We also looked at particular areas that might be more affected than others. And importantly, we tried to get a feeling for whether there was enough information about climate change and human health in that particular area, and whether it was widely available enough, and what sort of gaps there were in their knowledge. And then really starting to think about some of those linkages, those interdependencies that the health sector should have with other sectors to improve the way it was managed into the future. So as with many risk assessments, you come up with very detailed tables, and I don't expect you to look at the detail there. But essentially, again, fairly miraculously, when you look at the work we were pulling out of our interviews, we were trying to get a table together that's very similar to the one, again, that Peter showed in the tools that he was developing before, and really understanding those potential hazards, whether they've occurred in the past, are there existing strategies in place, do they work, are there residual risks, does this have potential to be more problematic in the future, what are those actions that need to be done that could help address these, and we also assigned a priority to those. So out of the different areas we looked at the different challenges from a climate change perspective. We looked at what sort of future risks there might be for hospital and health infrastructure associated with those particular risks. We looked at what sort of risks there were to operational activities, including those risks to staff and patients. And we also looked at how those different climate challenges might result in demand for services into the future. And you can see the distribution of the number of risks in each of those areas. And clearly, one of the big things that stands out is how much sea level rise will influence the demand for services into the future. So just in terms of those Torres Strait communities that are considered most at risk from climate change into the future, in terms of health, there's a lot of community members up there that have chronic diseases already existing, and the effect of climate change will be a multiplier in some of these particular issues, and will really influence people in that who suffer from those challenges already. The sick and the frail, so the elderly and young, and those who are really suffering from other issues will again be really affected by some of the issues with extreme events, but also heat, etc., and available of water. As we find with a lot of issues, those people from lower socioeconomic backgrounds who don't have the resources to address some of the challenges of climate change to their health are more at risk. And then there's different communities on different islands that we found had different levels of risk. So those lying on low-lying islands that are sand or mud in those villages are likely to be exposed in a lot sooner from sea level rise. And that then starts to create issues of disconnection with their land and the associated mental health challenges that have been seen before and that will be seen again in those communities, unfortunately. And of course, with the increases in heat, outdoor workers will have more stress on them from high temperatures and high humidity up in the area. So the cross dependencies that we identified were the electricity sector. The health system really relies on electricity. There are risks of blackouts because of loss of electricity during certain times. And then when you have generators being damaged, you then lose refrigeration, you lose air conditioning, and they have the resultant impact on people. There's loss of lighting when this happens, and so facilities aren't able to do night work, and loss of communication. And that then starts to impact their ability to service the needs of their stakeholders. And there was a big, strong feedback from people we talked to about the need for the electricity system to move from generators to renewable resources. They felt that would make it ultimately more reliable and safer, because we do have the other effects that come from overuse of generators in some of these communities. Water is a hugely limiting resource in a number of parts of those islands. Aging water infrastructure creates challenges. Water contamination creates a whole lot of different health issues. And a lot of people get asked to boil water, but don't necessarily do it, and that increases the rate of which they present to the health sector for support. And we also found that there's lots of challenges because people bring in bottled water, the hospitals use them, and then there's not great ways of disposing of those bottles into afterwards. And so you get a lot of waste challenges into those areas. An interesting thing that I found was a lot of discussion around the fisheries sector and its relationship to health. As we get a warming water, we start to get more coral bleaching. We start to get loss of the fish communities that people rely on for their lifestyle and for their livelihood. And as you're starting to get people losing their jobs because they can't fish for things such as painted crayfish, they then start to suffer more from challenges such as mental health and those sort of associated issues. So it really does flow through into the demand on the health sector. And again, the transport sector is really at risk. We've got low-lying airports. We've got people who rely on ferries and boats to move between all of those different islands. And as you get more storminess, cyclones, and even things such as increased sea level heights covering up jetties and boat ramps, the ability for people to move between those islands, which is so critical to their lifestyles, becomes more challenging. So we've made a number of recommendations in the report. The first is that it does need to move on to those next steps and really start to look at detailed risk assessments for each facility on each of those little islands, so that those can be measured and systems can be put in place to address those particular issues. That there needs to be a lot of effort on preventative measures to reduce the demand on the health system. So that's increasing the awareness and knowledge of health system professionals to deal with the issues of climate change as a risk multiplier, and put those processes in place for the communities so that they can be done, managed appropriately and sensitively. That climate change is a social ecological issue up there. There are challenges of fresh food. There's challenges with the community being able to generate incomes. There's incredibly strong cultural connections to the land and to the sea in that area. And as people start to get disassociated or dislocated from those, there start to be big issues in terms of their mental health. And I've mentioned that a few times, but it is a big issue. Food security and sustainability in the area is a big issue. There's not really easy access to decent vegetables and fruit. And so people don't have the right diets, which has a flow-through effect into the community. And then there's a need to really understanding what the sustainability, the carrying capacity of these islands are. So as some of these communities develop in numbers, you get more and more people living in single houses and with the challenges, as you see in the photo below, when you start to get higher tides even moving through houses, you're affecting a lot more people than you used to in the past. So that, in a nutshell, is some of the issues that we identified. And I think it's very clear that there's some very strong similarities between some of the coastal Bangladesh challenges and what we're finding up here, and definitely an opportunity to learn from one another and share the knowledge that we're generating in the work that's been done in between the two countries. So thank you very much.
Thank you, Dave, and thank you to both Peter and Dave for these presentations about the challenges to Queensland Health Service, especially in remote locations, which are posed by climate change. So if anyone has a question, please put it in the chat. And in the meantime, I think I'm going to ask a question myself, the chair's privilege. And it's one that can be answered actually by Peter and Dave, which is really about how you deliver health services to very remote locations, and about the fact that it must be extremely expensive to do that, and that you can't always do exactly what you want because of cost constraints, and how that's going to change under climate change, what new challenges are going to emerge. So Peter, do you want to go first with that one? You must have been thinking through things while Dave was talking.
Yeah, look, thanks, Jean. Where do I start?
Sorry, another
yeah, no. So the area that Dave was talking about is our northernmost hospital and health service area. We call it the Torres and Cape. And there is a heavy burden because a large percentage of the population are Aboriginal and Torres Strait Islander peoples. They're the custodians of that land, have been there for a long time. And the chronic health issues are, as David said, quite extensive. So, you know, if you're trying to manage your own garden and you get a tidal rise, which then destroys it, straight away your fresh food source is gone. A lot of food has to be shipped out to the area, highly expensive. And then we've got a population that's not a high earning population. So their ability to purchase these or purchase alternatives is severely restricted. So yes, we've got a range of health conditions. The hospital and health service itself operates in a number of modes. So COVID has taught us that we can operate remotely to some extent, and those services have been strengthened. Serious conditions, though, are still transported out of the Torres down into the major hospital, which is Cairns, some hundreds of kilometres to the south. So treatments needing hospitalisations are then transported by air. The area can be cut off for many months of the year due to climatic conditions. So outside of that, what we've got is a high-risk population, limited access. We've also got the issue of recently reported that there is an emerging exodus of health professionals from the tropical regions because of rising heat into more temperate areas, simply because it's just in some places too hot to work. That's been reported for Darwin, which is in an adjoining state, but it's at the same latitude. So we can expect the same issues emerging here. So we've got some serious challenges. These risk assessments, Dave's in particular, kick the process off and start to heighten the areas of awareness that are needed to be exposed and progress further. So is there more work to be done? Yes, there is. I guess that's all I can really say on that.
Dave.
I guess I would respond to, I mean, my feeling is, again, Peter's covered that, but the challenge of getting staff into those areas is a massive challenge. The skill sets that are needed to address the existing health needs, let alone the future health needs, are huge. But what I was impressed about is the people that do go and work there are hugely committed, and they make a significant effort to understand their community and to really think about what can be done on a holistic basis, not just what's the next operation that's required, or how can we give people the medication that's required. So they buy in, but it's just inhospitable, and you can't be there forever. So there is a discontinuity often of the staffing in those areas, and I think that will be a big challenge in inhospitable climates into the future. Not only the northern tip of Queensland, but also the far west, I think will also be an issue with heat and attracting good staff.
Thanks. Fahim, you've raised your hand.
Thanks, Jean. It was really interesting discussion going on. So I thought I'll just put some Bangladeshi context in the discussion, which is quite similar to what we're discussing here. That in Bangladesh also we faced similar challenge of getting key staff into remote areas, regional areas, to go and stay there and work, and quite similar challenges that we're talking about. And because of and it's nothing to do with climate change at the moment. It's just a trend in socio-demographic trend in Bangladesh that people want to live in capital cities. More, that is the key staff that, like the brilliant doctors or health professionals, they want to live in the city areas. So in terms of from climate change point of view, I think the similar issue we will see in Bangladesh as well. I thought I'll just flag that in the discussion.
I'm guessing that both in Bangladesh and in Australia, people are paid a supplement to go and work in these areas, but it just isn't enough because of things like once you have children, you need good schools and so on, and then that's it. You have to move. And how you overcome that, I don't know. But that, as you say, is a social problem and not one that's caused by climate change. I thought Peter's comment that COVID has actually taught us quite a bit about how to manage health services under climate change was an interesting one. And you are seeing a literature coming out about adaptation to climate change, adaptation to COVID, and what are the similarities and the learnings, the cross-learnings.
It's true, Jean. Fahim and I were talking last week to people from the Sunshine Coast Hospital Service and around their disaster management, and they said prior to COVID they were not well equipped to address a lot of the challenges with disaster management, but COVID's forced them into really thinking about their procedures and their standard operating plans and so on, and they feel that now they're in a pretty good space to address emergencies. So maybe there is a little positive underneath all the COVID pressures that people have had to deal with.
Do you want to reflect on that, Peter? Do you see that cross-fertilization of ideas between managing climate change and managing COVID?
Short answer, yes. I think we had the situation with COVID that we had to handle a health burden, but often at arm's length. We also had to handle large loads of health burden. And, you know, I guess the thing that's separate to this is the cultural overlay. David referred to that repeatedly with the islands. So they carry about, just to give a context, about 2.5 times the health burden of wider Australia in their populations. But it's about dealing with that and remaining culturally sensitive to their priorities and processes. And we're trying, but, you know, I don't think there's room for improvement in that area in particular. But I'd also like to add that one of the most enlightening features of coming to work with Queensland Health a number of years ago was the incredible commitment and professionalism of staff. And David highlighted that staff will work very hard to get where they need to. I guess with the cultural overlay, we've got a number of primary care facilities throughout the islands that are run by Indigenous organisations. And I guess they're the front line, and strengthening those services would provide a huge benefit going forward.
Okay, so Dave, Peter, do either of you want to reflect further, or shall we move on to Bangladesh?
I guess the last thing I would say is it's not an issue that's only related to the health system. It's not up to the health department to solve all these issues. It's an everything issue. And again, the need to address these by having an integrative approach that every agency, every part of the community and community leaders needs to come forward. So you have a whole of system approach, and then you're more likely to get the outcomes. Otherwise, people like Peter are left sort of at the end of the supply chain of ill people coming forward all the time and feeling that it's all their issue to deal with, whereas it's not. It's a system issue.
Yes, we used to use the phrase about climate change that it's a threat multiplier. I haven't heard that phrase used recently, but actually I think it's still a very useful way of thinking about climate change. Okay, so I'm going to move on now. Dave will have to leave us now or shortly or whenever you wish, Dave.
Thanks. I'll drop off when I have to. Thanks, Jean.
Thank you for participating. Peter, I'm hoping you can stay to the end, but if not, thank you for your contribution if you have to leave us. So I'm going to talk now. Let me see if I can find my presentation. Where are we? Yeah. So hopefully you can now see that. And I'm going to talk about this project, Managing Heat Stress Among Bangladesh Ready-Made Garment Factory Workers. And I'm just going to introduce this project, and then Fahim will come in and talk in more detail about some of the results. So this was a project that was funded by Wellcome. Wellcome is a very large philanthropic charity based in the UK, which funds research globally. And it has one of its 3 research themes at the present time is climate change and heat. The other 2, if you're interested, are mental health and infectious diseases. But climate change and health is a major focus of Wellcome at the present time. And they funded this project, Managing Heat Stress Among Bangladesh Ready-Made Garment Factory Workers. It's a 3-year project. So let's just think a little bit about why this project would be important. And there were 2 ways to think about this. One is why is the industry important? And the other one is why is climate change important for the industry? So our Bangladesh listeners will know very well the importance of the industry to the economy, but I'll just run through some numbers for you. It's a mainstay, a strong driver of economic growth and a major contributor to GDP. Counts for 84% of exports by value from Bangladesh and 12 to 15% of GDP. In 2019, it contributed $34 billion to the economy and employed around 4 million people, which is, I know it's a big population in Bangladesh, but still 4 million is substantial. Unusually in low and middle income countries, it's a major employer of women. 60% of the workforce are estimated to be female. And it provides financial independence to young women of modest education, which, as I say, is rare in low and middle income countries. So it's important. It's important to the economy, but it's also important socially. It gives autonomy to young women. It pays for marriages, it pays for dowries, it pays for cows, it pays for a lot of things for these people. I think you can't underestimate its importance in the lives of many people in Bangladesh. Okay, so that establishes why the industry is important. So why is heat stress a consideration? Well, Present day working conditions are stressful in the factories. It's very noisy, but it's also extremely hot. So heat stress is a significant factor in contributing to how comfortable the workforce is, and hence how healthy it is and how productive it is. And Chowdhury and colleagues in 2017 did a study of one factory in Dakar and found that conditions were above comfortable from May to August, and that the risk levels were high for 25 to 38% of the time during that summer season. It's not only, of course, today that heat stress is a significant factor. Things are only going to get worse in the future. So Bangladesh has been identified as a climate change hotspot, and average annual temperatures are expected to increase by something like 4 degrees by 2100 for a high emissions scenario for greenhouse gases. And if you think that we're going to be able to limit our emissions of greenhouse gases globally, then even so, the temperature increase is likely to be of the order of 2 degrees. So it's certain that there will be more frequent and more severe heat waves. Rainfall may increase, so it's likely that humidity, which is also a factor in creating heat stress, is going to remain the same or actually get worse. So what is certain is that heat stress is going to increase in the future in these factories. So what's this project about then? Well, we're looking at heat stress among workers in a single factory in Dhaka. And for that factory, we're interested in what are the present day working conditions, where in the factory and when in the year and when in the day is it hottest and most humid, how will these conditions change in the future as a result of climate change, and are there additional low-cost strategies, and low in terms of both money and CO2 emissions, to cool the factories? There's some way that the dependence on air conditioning can be limited. So why are we doing this? Well, as I said, temperature and humidity are already high and will likely increase in the future. Currently, the industry relies heavily on mechanical ventilation, fans, and also air conditioning. And most of the energy in Bangladesh comes from carbon-intensive sources, coal, and in particular natural gas. So energy costs are high and will increase in the future. The electricity supply can be erratic, so a number of factories, many factories have their own generators. Those are powered by diesel, so of course that's a carbon source as well. So with no change, just to maintain current internal temperatures as the climate warms, the industry will increase its emissions of greenhouse gases. So the major question for us in this project is to identify sustainable cooling strategies that will not lead to an increase in greenhouse gas emissions. And that's the core of the project. Who are the participants? Well, here in Australia, BMT through Fahim, who will speak next, is a partner. I'm based at Griffith University, so I bring the university to the partnership, and we're also working with the University of Sydney, Professor Ollie J. And in Bangladesh, our participants are, of course, the factory, Buit, which will be known very well to our Bangladeshi listeners, Professor Ashik Juada. Innovase Technology is a small startup company which has helped us very much with the instrumentation side of the project. Because of COVID, we weren't able to visit Bangladesh at all, in fact, during the project, whereas we had planned to visit a number of times from Australia. So we worked with Innovase to help us with the instrumentation side, and we also worked with ICCCAD to help us with the worker surveys, which I'll explain a little bit more about in a moment. So this shows you the components of the project and how they fit together in order to address the three aims. So if you look on the right-hand side, the three aims are to look at the present-day effects of heat stress in the industry, through looking at our factory, our example factory, to look at through aim 2, to look at the effect of passive sustainable cooling strategies on the present day internal climate of the factory. So those passive sustainable cooling strategies might be, for example, a green roof. If you grow grass on the roof, that has a cooling effect, or to paint the roof white, because that has the effect of reflecting heat. So you can have those large scale changes, but you can also use small scale changes at the individual level by changing hydration, by providing individual fans for workers, by providing them with misters so that they can cool themselves by misting themselves with water. So a number of strategies that you can use that don't have this high intensity of energy use, where that energy is derived from coal and natural gas. And finally, the aim is to look at how those identified cooling strategies might work under climate change. Can they actually deliver what is needed under climate change in order to at least keep emissions of greenhouse gases stable as the climate warms, or ideally to reduce emissions of greenhouse gases. So I'm just going to look through the three sort of instrumentation, as you might call it, side, or the data derivation side of the project. Where did we get the data from the project? And there are three boxes here that look at that. One is measuring the climate in the factory. One is carrying out workers' surveys to understand how they experience heat stress. And finally, the University of Sydney did this climate chamber work to understand the physiological impact on workers from the internal climate of the factory. So next slide. Just says a little bit about the climate measurements. So intensively monitored the internal climate of the factory. So we had an external weather station that told us what the external conditions were doing. So you can see this outdoor, the column that is about the outdoor climate. And then we monitored with a number of sensors, 5 or 6 on each floor, the climate of the ground floor, the first floor, and the second floor in this 3-story factory. And there are just some figures here for the 3 periods when we took our surveys of the workers. So the worker surveys took place over about a week. So these figures are coming from the 3 months when we carried out the worker survey. And you can see that it's the top floor which has the most unpleasant conditions. The temperature on the top floor in March during the working day could rise as high as 36 degrees. And even in September, when conditions are very humid, the temperature on the top floor was reaching 34 degrees with a relative humidity of about 64% at that time. So really thoroughly unpleasant on the top floor of the factory, which is holds out some hope for strategies like green roofs and white roofs, because it's the top floor of the factory where things are really extremely unpleasant. That's just a little bit about the actual factory of the climate. Then we carried out surveys amongst the workers over about 4 days, around 3 times a day. We spoke to a sample of around 40 workers working in different aspects of the industry, ironing, sewing, packing, and so forth, to understand how they felt about heat stress. We haven't fully analysed this data yet. There's just some information on the left side of this slide. So you can see that their experience does change between the winter months and the summer months. So in January, over half the workforce were perfectly happy with conditions, although even in January, 38% of the sample wished that things were cooler. And 80% were happy with the humidity level. So in winter, conditions are for most of the workforce satisfactory. And this changes completely when you come to the hot, humid season. So we did the survey in September to be representative of the hot, humid season, when 78% expressed of our sample expressed a desire for cooler conditions, and another 70% for less humid conditions. So clearly, the workers are experiencing rather severe conditions at certain times of the year, and the levels of cooling in the factory are not as satisfactory as you might hope. Finally, we did, or the University of Sydney is currently ongoing, is carrying out this climate chamber work. The goal of this is to actually look at the physiology. So we talked to the workers about their perception of their comfort levels, but you have to actually take measurements in order to understand what's actually happening, physiologically speaking, to their bodies. And to do this, we couldn't go to Bangladesh, and even if we could, we would not really have wished to subject the workforce to the measurements that can be done in the climate chamber in Sydney. So just looking at this little graph, we tried to mimic the working environment of the factory in the climate chamber. And you can see that the lady here, we've tried to mimic the dress that the factory workers have. I'm not sure that we could properly mimic the noise levels, but there you go. But you can see from the graph, so this is looking at the core temperature of one participant in the climate chamber work over a period of 176 minutes, so about 3 hours. And you can see that her core temperature when the chamber was air conditioned, that's the blue line, remained very stable. But if there was no attempt to control the situation, her core temperature went up over time, and that's the black line. A number of interventions were tried. So you can see we tried a fan. We tried a fan plus a water spray. We tried a green roof, which involved reducing the temperature by between 1 and 2 degrees. And we used a green roof plus a fan. And you can see that all of those strategies had some effect on the core temperature, some ability to reduce the core temperature compared to the black line, which shows the situation with no intervention whatsoever. So we have measurements of the actual levels of heat stress through the core temperature and the perceptions of heat stress through the worker survey. So these feed into these measurements feed into the green boxes. So through the green boxes, we look at through the analysis of the data, and also by building climate change scenarios, which I haven't described here, but we have built scenarios of climate change in Bangladesh using the output from climate models. We can look at the effect of global warming on the internal factory climate. We can identify optimal sustainable passive cooling strategies, such as green roofs and white roofs. And then we can examine the performance of passive sustainable cooling strategies under climate change. And then that all leads forward into addressing these 3 aims to look at present day heat stress, the performance of passive sustainable cooling strategies on the present day climate of the factory, and finally the capacity of these cooling strategies to improve factory climates under climate change. So that's just a brief overview of the project. And now I'm going to hand over to my colleague, Fahim Tanmoy, and he's going to give you some more information about results from the project. Thank you. Just trying to stop sharing. Thank you.
Thank you, Jen.
Over to you.
Thanks, Jen. I'll share my screen.
Yeah, I'm trying to stop sharing here. There we go.
Great. Here it is. Can you see my screen?
We can.
Great. So thanks, Jean, for the introduction and providing an overview of the project. In my presentation, I'll talk a little bit about some of the preliminary results that we are getting from the different component of project that Jean just presented. So my name is Fahim Tonmoy. I was born and brought up in Bangladesh, graduated from BUET, and currently working in Australia in a consulting company called BMT, and also an adjunct research fellow here at Griffith University. And in terms of Jane's point about why garment sector is so important for Bangladesh and why climate change is so critical to manage for the sector, it's really a critical project that we are trying to create some knowledge base for the industry to go forward and start thinking about some adaptation strategy for future. So this is, I'm just bringing back the overviews flow diagram that Jean just presented. So I will start by presenting some information from the box 1, which is the measurement of present day condition. So what's the working condition within the factory at the moment? So so Jean presented the average of different season. I'm just trying to present a snapshot. Let's imagine we are in the factory on the 22nd of March at 2 p.m. and let's see what the condition looks like inside. So as you can see, we are on the 3rd floor, and this is the picture of the 3rd floor. And right hand side, you can see at 2 p.m. the temperature distribution across different floors. So this is the first one. Down here is the level ground floor, and the top one is the top floor. And the dots here are representing the sensors that we installed within these factories, within this space. And you can see, and the color scheme is representing the temperature profile, which is ranging between 30 to 40 degrees. So you can see a lot of variability within even a single floor. So some floors in ground level, for example, are in the lower 30s, and some areas are in the mid 30s, whereas you can see in the level 2 at 2 p.m. Some areas are really, really hot. It's around 40 degrees. But whereas some areas in that floor, which is close to the windows, are relatively cooler. So this gives us, so one important thing to understand here, the difference between outdoor temperature and indoor temperature. So the outdoor temperature at that 2 p.m. on 22nd of March was 35 degrees Celsius, whereas some areas were cooler than that in the ground floor, whereas some areas in the top floor was really hotter than that. So this is just the present day condition. Now, if we think about climate change point of view, so present day, the average temperature of when it goes over 32 degrees, currently it is like 4 days in Bangladesh. But under RCP 8.5 high emission scenario, these numbers are likely to go lot higher. So 1/3 of the year, you can imagine having that type of condition within these factories, and almost half of the year is towards the end of the century will be like that. So it's not just one-off event that this factory will be experiencing like they do now. And that difference of outdoor versus indoor temperature will still continue in the future. So it's really important for us to understand why some of these areas within the factories are so much hotter than the other areas. What are the sources of it, and how can we cool it down? So that's what the Jean was mentioning, there was cooling strategy. How can we think about the cooling strategies? So in order to be able to understand this, that's where we need a computer simulation model, so potentially this increase in between outdoor and indoor temperature is contributed towards the building construction, or maybe the way the building schedules run, like sometimes some windows are open, sometimes windows are closed, fans are running, sometimes the factory is running from 7 to 8 p.m. So when the peak of the activities are happening, a lot of machineries are working in the factory, they're generating a lot of heat. So that are also contributing towards this higher indoor temperature. So in order to understand that a bit more detailed, we need to create a building thermal comfort simulation. So which starts by from a like a plan of a building, of a factory, and then construct the building in the software, and then ultimately assign what type of building construction it has, what type of material it has been used, what type of insulation that building material has, what sort of roof it has, so on and so forth. And then what type of building schedule are under which schedule the building is operating, like when the windows are opening, when the windows are closed, what type of machineries are being used, and what type of heat they are generating. Some of the machines, like for example, ironing machines, generate a lot of heat within the factory compared to some of the other machines like sewing machines. So where those machines are located, what type of occupant behavior is observed within the factory, which is in terms of when do they go for prayer breaks, when do they go for lunch break, and that varies the temperature profile throughout the day. So all those things, when we put into the model, it's the software called Design Builder, which is powered by Energy Plus simulation software. It tells us the temperature profile that we can expect under a given condition within the factory flow. So it provides us a simulation of that variability that we observed, and then we try to calibrate the model with our observed information by readjusting some of our assumptions that this building is constructed by that. So it had this insulation. We assumed some building schedule, some types of equipment that are being used by the factory. So when we change those things, it helped us to calibrate the model. So so far we have calibrated the model. This is just a snapshot of the calibration. So this graph is showing x-axis is every hour of 2021, y-axis is just the temperature, and the measured temperature every hour in the factory is the blue line, whereas the orange line is the model through simulation. So you can see broadly it matches quite nicely, able to capture those peaks and troughs, and error rates are within the acceptable range of ASHRAE. So I won't bore you with all these details, but the model is now calibrated. What we're trying to do now is the right-hand box that I have it here. So model is calibrated. Now we're trying to understand what if we add some of the sustainable graining strategies in the model, what benefit it will bring in terms of thermal improvement, and we're also trying to apply the future climate on top of that to understand how the future, under those climate change conditions, what will be the temperature profile within the factories. And some of the cooling strategies that we are looking at, Jean already mentioned some of these things. So those are like a cool roof. So it's a high reflective roof, which is like a high reflective coating that we can put on top of a roof that will increase the albedo and reflectivity so that the factory will not absorb heat as it is absorbing now. Another option is we're looking at this green roof by adding vegetation on top of the factory, as well as we are also looking at some of the shading that we can add to the factory. Some of the vertical shading that can reduce some heat gain in the side of the walls, or shading on the roof that can help cooling the top floor So all these are sustainable strategies without contributing much towards the increase of greenhouse gas emission. We can always add air condition to cool it down, but in terms, so that's not the purpose of this project. Is to understand how sustainably we can start bringing down those temperatures. So that's the first box. So if I bring back again that structure overview of the project, the first box I just talked about, which is the measurement, what the current condition is, and box number 2, which is the energy plus modeling that we are doing to using that measurement and trying to calibrate it. And all these 1 and 2 boxes then will help us to understand what are the identification of optimal thermal strategies. So box number 3 is also related to this understanding of identification of sustainable strategies, and Jean also already mentioned what's happening in that climate change experiment. They are measuring a number of physiological parameters under the conditions that we are observing in the factory. Trying to understand what it means in terms of continuous heart rate, skin temperature, core temperature, dehydration, body sweat loss, and level of thrust. All these details in there, trying to understand so that we can understand what is the optimum solution among all these sustainable strategies that we are talking about. Is it cool roof, green roof, or a combination of these? Or are there any soft solutions that we can design? So that component is underway. Then the box number 4 is actually going to the factory and trying to understand from them that what's their perception about workers' perception about the lived experience of their working in these hot conditions. So I'll talk a little bit about that. So as Jean highlighted in her talk, that we surveyed the factory in 3 occasions in 2021. Main idea was to survey them once when it is cool and dry in January, then again survey them when it's hot and dry towards March, and then later in the year when it starts to become humid in September, hot and humid conditions. About 67 people were surveyed, 31 males and 36 females, and their age ranges between 20 to 56, and with a mean of 31 years. And there are different types of job that people were doing among our survey participants, like some of them were doing cutting, packing, ironing, and a lot of other activities. So we tried to diversify the job that they were doing so that we can capture view of different job that people are doing, not just one particular group. And the survey was carried 3 times a day, morning, midday, and afternoon for 4 days. And the main goal was to try to understand to what extent they see the condition as unpleasant, and what mitigation options they have on their hand to help them going through those extreme heat conditions within the factory. We also measured the participants' physical characteristics like weight, height, what they're wearing, what's the primary task, because all this information we need to create a thermal comfort model, which I'll talk about in a sec. And the survey was carried out in Bangla with open-ended questions. So what do we do with all this information? That's the biggest question. So what we're trying to do at the moment. So ASHRAE is an international standard that provides an understanding of what should be the working condition and if under a given set of temperature and humidity and wind speed. So for example, they developed some models. It's called thermal comfort models. Some of them are called it's called predictive mean vote, PMV. There's another type, it's called adaptive thermal comfort model. What all these models does, they have used different chamber experiment through research, and they tried to understand how human body reacts under a given set of temperature, humidity, and wind speed. And based on the exposure that a human body is facing, what they should be considering that condition as neutral, or is it a very hot condition, or is it a very cold condition. So for a given set of temperature and humidity and air velocity, there should be what PMV is telling us, that it should be a range between which the people living within the working in the factory should be comfortable. There should be a range. And what we are trying to do is we are trying to create those models using the measurement that we got from the factory. What's the model is telling us, that whether it is acceptable or not. And then we're trying to compare it with survey responses, what workers are telling us. And what we're finding so far, is very broad summary, is the first graph is just an example of PMV model using ASHRAE standard. And it's saying that across all seasons, the conditions as per ASHRAE standard is too warm, and it should be considered very warm in spring because it was very hot and humid, where it's getting a slightly better in winter. Whereas what we are getting out from the workers is there seems to be more adaptive to the conditions, and the level of acceptance is higher in terms of what they're telling us. There's a lot of other details that we're asking them, like, do you see the temperature is good for you, the humidity is good for you, the wind, do you see should be a change in air speed, and so on and so forth. But at the end, we're also asking them, do you see the overall condition to be acceptable or not? But overall condition, what they're saying, the green bars are largely acceptable in winter, hardly any unacceptability, which is expected, and it is also acceptable largely in spring, but the acceptability reduces in summer. So what this is telling us, what's the thing that we're pondering at the moment? Does it mean that we need a separate thermal comfort model for Bangladesh? And that's something that we are trying to explore going forward. And also now we are trying to understand to what extent some of the other factors like age, gender, tasks that people are doing, location where they are working, to what extent these factors play a role in their thermal discomfort. So why we're trying to understand that? Because this will help us to design targeted softer heat management intervention that we have been talking about. If we understand that a particular section in the factory or particular age group is feeling most thermal discomfort, then that targeted management solution can be designed within the factory, and it can be broad enough for the whole garments sector in Bangladesh, in terms of when there should be a heat management situation triggered within the factories. If the heat management condition is triggered because a heat wave is going on, what should be people doing within that condition, within that type of situation? What type of dehydration they should be planning? And so that can lead to some of those broader discussion. So that's where it's all connecting. So we talked about what's the present day measurement we are finding in the factory. We talked about how we are using them to validate our Energy Plus model so that we can start understand what sort of sustainable strategy will bring more, will be optimum solution to manage those under climate change. And we're also looking at the human health component of that through those chamber experiment. And ultimately, the idea is to, when everything, we finish all the analysis, it should be helping us to zoom out from this project and start thinking about what it means for the broader industry in the RNG factory in Bangladesh. So this is just a very broad results that we have been finding so far. And I think I should stop talking about this particular project, and we have 10 minutes left for question and answer and some discussion. Does anyone have any question for Jean and I before I move to the discussion session?
I have a quick question for you, Fahim.
Go ahead, Peter.
I guess you're looking at the heat impacts. Do you have a balance model between the heat generated internally and the heat brought in from the external environment? And secondly, do you understand how heat moves within the building once it's generated in one area?
Yeah, so the thermal comfort model that we are developing, if I bring back that slide. So this thermal comfort model is helping us to answer those questions, Peter, that what's the element of the building which is contributing towards that internal heat generation, such as do we have equipments which is generating a lot of heat in a one particular flow. And in terms of moving of heat between the area within a given factory, that's what this thermal comfort model is doing, that it is trying to simulate this temperature distribution across the factory, how the heat generated in one part of the factory can be experienced in that other part. So it is a computational fluid dynamics CFD model, so which basically tries to estimate heat transfer between each cell within each factory, given the condition that we are telling the model that, hey, this part of the factory has this equipment, this part of the factory has this number of people working there. This is broadly the construction of the area. So tell us what would be the heat transfer between different cell within that area. So that's helping us to understand that variability across.
Could I also ask whether you've looked at operating conditions in terms of, at the moment, as the day heats up, you've got more and more heat impinging on the building. What about, I don't know if the factories operate 24/7 or not, but I'm just wondering about staggered working hours, where you split the working day into the cooler parts of the day or evening.
Yeah, that's a really good point, and Peter. That's working hour is part of this building schedule and occupant behavior that went into this model. So currently, factory works from roughly between 7 a.m. till 8 p.m. at night. So it's a long working day for them, and they have. And that includes their overtime and everything, but broadly that's 12 to 13 hours working period. But whether we can have those staggered working hour, that's something up for discussion with the industry and the factory owners, whether that's acceptable for the employees or not. That's the type of thing we will be hoping to engage with them once we finalize these results, that how do we not just manage this through harder solutions like structural intervention, but also some of these management solutions like staggered working hour.
I don't think there's a lot of scope for staggered working hours, in fact, especially with a largely female workforce.
Yeah. That's another one.
You don't want them going home, late at night. It's culturally inappropriate, probably in Australia as well as in Bangladesh.
Any other question in the chat box, Jean?
I haven't looked for a moment. Let me just have a look. I can look now too. I didn't see anything last time I looked.
No, I can see in that, and the Samuel Hassan is here. So Samuel Hassan is an assistant professor at University of Central Florida in US, and he's also from Bangladesh. He works in the climate change area as well. Samuel, do you have anything to add in the discussion from what you heard here?
He has to unmute, or someone has to unmute for him, because he's the audience. He's not the participant. So
Hello. Can you hear me?
Yes, I can hear you, Samuel.
Yeah, so very good presentation. So I was listening to the difference between like the top floor and the bottom floor. There was a 10-degree differences between the bottom floor and the top floor. And is there any kind of awareness among the factory owners or the workers about that this difference? And even this is like not like about climate change, this is about the current situation. Even though the outdoor temperature is much lower. So is this much more immediate problem that they need to solve rather than, so that is one question that I have. And the second question is about the thermal comforts model that you have. So what is the basis of that? Like there's a huge discrepancy between what thermal comfort is saying and then what people are actually telling. So is there any basis of, is it customized to the condition for a tropical climate like Bangladesh, or is it like from the basis of that thermal comfort is from another country where this is like a much more, they're much more sensitive to the temperature changes?
Oh, well, I'll go with the first one for him, and you can go with the second, and you can reflect on the first as well. But from my perspective, I don't think there is maybe as much awareness, at least amongst management, of the different conditions on the different floors. Most of the ironing, which is the large generator of heat, goes on the top floor. So if you were thinking about how to maximize the comfort, you would probably move the ironing off the top floor and put it either probably on the middle floor, which seems to be the coolest for whatever reason. But it would be worth exploring moving such a high generator of heat off the top floor. I don't think there's any doubt about that. So someone's thinking more about the management of the work stream than they are thinking about maybe the comfort of people carrying out the different activities. Over to you, Fahim.
Yeah, thanks, Jean. I think you're absolutely right. We did a presentation to the factory owners, informing them about these drastic changes. But broadly, if in other factories, if this type of study is not going on, they're probably not aware of this type of situation. In terms of your second question, Samuel, what's the basis of this thermal comfort? So these ASHRAE standards are developed mostly for European and first world countries. And there are studies that have been done in some tropical countries, like in India. They looked at what it means for Indian condition. And so there is definitely a case for doing the similar for Bangladesh, that what changes it needs to be made in those acceptability of those conditions, so that they more reflect the actual perception of local people, because they're probably more adapted to the that hot and humid condition compared to the other areas for where those ASHRAE standards were developed. So there is that is one of the things we are also looking at in this project.
We're out of time for him.
That's it. Yeah, thank you. Thanks, Samuel, for your question. I think I just want to wrap up with our session. I think we're running out of time. So we had a really good discussion from our panelists. covering a very two distinct type of scale of looking at the problem. One was a regional scale and at a whole system scale. The other one was a very local and within a building scale, and trying to understand, but both trying to understand what it means, climate change means for health. So I hope it was useful for the audience. And through that, I would like to hand over to Eugene to close the session off.
I have nothing to say except thank you to all the speakers. It's been a really fascinating set of presentations and also a fascinating discussion. Thank you also to the audience for participating and to the Gobeshona organisers for allowing us to participate and have this session. So thank you very much to everybody.